Calcium homeostasis is associated with which fat-soluble vitamin? Vitamin D. Clotting factor synthesis depends on which fat-soluble vitamin? Vitamin K. Which fat-soluble vitamin acts as an antioxidant? Vitamin E. Which groups of vitamins are water-soluble? B vitamins and vitamin C. Is vitamin C fat-soluble or water-soluble? Water-soluble. Is thiamine fat-soluble or water-soluble? Water-soluble. Is riboflavin fat-soluble or water-soluble? Water-soluble. Is pantothenic acid fat-soluble or water-soluble? Water-soluble. Is cobalamin fat-soluble or water-soluble? Water-soluble. Are pyridoxine, pyridoxal, and pyridoxamine fat-soluble or water-soluble? Water-soluble. Is ascorbic acid fat-soluble or water-soluble? Water-soluble. Deficiency of which two water-soluble vitamins can cause macrocytic anemia? Folate and B12. Which water-soluble vitamin is associated with collagen synthesis? Vitamin C, ascorbic acid. Name two vitamins that serve as antioxidants. Vitamin E and vitamin C. Name the four fat-soluble vitamins. A, D, E, and K. True or false? The absorption of fat-soluble vitamins depends on the pancreas as well as the gastrointestinal tract. True, pancreatic lipases are necessary for absorption of fat-soluble vitamins. Is accumulation of fat or water-soluble vitamins more likely to cause toxicity? Fat. Name two malabsorption syndromes that can cause fat-soluble vitamin deficiencies. Celiac disease. Cystic fibrosis. Commonly cited in Harrison's and Robbins as classic causes of fat-soluble vitamin deficiency. All of the water-soluble vitamins easily wash out from the body, except for which two? Vitamin B12 and folate. In which organ is folate stored? The liver. B-complex deficiencies often result in what three conditions? Dermatitis, glossitis, and diarrhea. What is another name for vitamin A? Retinol. What are the signs and symptoms of vitamin A deficiency? Night blindness and dry skin. Vitamin A is a constituent of what visual pigment? Retinol. What are the symptoms associated with vitamin A intoxication? Arthralgias, fatigue, headaches, skin changes, sore throat, and alopecia. A man has recently been eating large amounts of liver. He presents with fatigue, hair loss, headache, and joint pains. What is your diagnosis? Vitamin A excess. What foods contain high amounts of vitamin A? Vitamin A is found in liver and in leafy vegetables. Name 2 topical uses of vitamin A. It can be used topically for wrinkles and for acne. What are the effects of taking large amounts of vitamin A during pregnancy? It is a teratogen and causes cleft palate and cardiac abnormalities. What is another name for vitamin B1? Thiamine. Beriberi is caused by a deficiency of which vitamin? Vitamin B1, thiamine. Wernicke-Korsakoff syndrome is caused by a deficiency of which vitamin? Vitamin B1, thiamine. Vitamin B1 is the precursor to what metabolic cofactor? Thiamine pyrophosphate. What is the role of thiamine in the tricarboxylic acid cycle? It is a cofactor for ketoglutarate dehydrogenase. Which step in glycolysis requires thiamine? Thiamine pyrophosphate is needed as a cofactor for pyruvate dehydrogenase. What vitamin is needed as a cofactor for branched-chain amino acid dehydrogenase? Vitamin B1, thiamine. Are polyneuritis and muscle wasting characteristic of wet or dry beriberi? Dry beriberi, wet beriberi is associated with high-output cardiac failure and edema. Why are alcoholics prone to beriberi and Wernicke-Korsakoff syndrome? Malnutrition and malabsorption. An alcoholic patient in the emergency room has recent onset ophthalmoplegia, confusion, and ataxia. You suspect what disease process? Wernicke-Korsakoff syndrome. Why are the brain and heart susceptible to injury in thiamine deficiency? Cells cannot generate adenosine triphosphate. What is another name for vitamin B2? Riboflavin. Chylosis and corneal vascularization occur as a result of a deficiency of which vitamin? Vitamin B2, riboflavin. What is chylosis? Inflammation of the lips, with scaling and fissures at the corners of the mouth. This is seen in vitamin B2 deficiency. What is another name for vitamin B3? Niacin. What are the 3 Ds of pellagra? Diarrhea, dermatitis, and dementia. True or false? Eating excess untreated corn can lead to pellagra. True, vitamin B3 in corn is not absorbable unless treated. What are the symptoms of vitamin B5 deficiency? Dermatitis, enteritis, alopecia, and adrenal insufficiency. What vitamin is a precursor of coenzyme A, a cofactor for acyl transfer? Vitamin B5, pantothenate. Adrenal insufficiency may be caused by a deficiency of which vitamin? Vitamin B5, pantothenate. What are the clinical features of vitamin B6 deficiency? Convulsions, hyperirritability, peripheral neuropathy, and sideroblastic anemias. A 32-year-old man begins taking isoniazid after a positive purified protein derivative. He presents with numbness and tingling in the extremities. What is the most likely cause of his peripheral neuropathy? Vitamin B6, pyridoxine, deficiency induced by INH. Subscribe to learn more. How many did you get correct?